Welcome to the Dr. Berkson's Best Health radio show. And it has been a huge challenge for me to stay in best health recently. I have this hat on in honor of the sequence of events. So about, I don't know how many weeks ago, many weeks ago, I got COVID, and it was a nothing for me. And that is part of the angst of this disease, is you don't know if it's going to be a serious issue for you, landing you in the ICU with intubation and threatening an amputation of a leg, or whether it's a nothing. So I took ivermectin and all those nutrients that you've heard many times about it. Now, I had an easy time. I never was tired. I mainly had a headache for a few days and some aches and pains. But the point is, about a week later is when the cold disaster hit in Texas. And for some reason, my neighborhood had the earliest outages, and we stayed having outages, sustained the last 5 or 6 days. The first few days were a little bit off and on for almost 9 days, 8.5 days. So my house went down to the 40s and the 30s. I live in great hills, lots of hills. So a tow truck trying to help a number of us got stuck in the snow in front of my cul-de-sac for almost 2 days. Kids were sledding down the hills, but there was so much ice and then a layer of 8 inches of snow with ice on top. There was no getting out of here unless you had a 4-wheel drive. And I have a very steep driveway. So for about 5 days, I had no computer, no Wi-Fi. I'd have my phone if I went and sat in the car. And it was so cold. And there was no getting away from the cold. And at night, I was in the black dark with no technology, no TV, no computer, by myself. It was really, I've been through so many things, as you know, but it was one of the experiences where I had to really dig deep and figure out how to keep myself sane. My blood pressure started to soar just from tightening up so much. And just a series of events, then that made my eyesight in the eye that I'd healed the last few years. I woke up and it was worse again. So many different things you had to deal with besides not being able to work and get anything done. I think I have a little bit of PTSD from that. And the thing that was aggravating is that we heard from Austin Energy the first few days when the power was out for 12 hours and then it came back on for 20 minutes. And we heard about 2 or 3 texts that we were getting outages. But the rest of the time, for days and days and days, we never heard from the Austin Energy Company. And really, the governor and the politicians didn't kick in till about the 8th or 9th day. Anybody, really. I got so bad one day, they said, call 211 because we're getting the military. We're going to get all kinds of help. And I wanted to get some help. And I called and left a message and nobody called me back. It was really, finally, a friend of mine was going to send somebody with a 4-wheel drive. And that night, the power came back on. But the water company let us know when the water was going to go out, which we were out for about 5 days. They gave us texts and emails and phone calls to let us know what was going on. So a company can do that if they want to. So it turns out that the only city that's off the Texas grid is El Paso, because in 2011, we had a freeze that was bad, not as bad as this. And El Paso said, forget it. Let's be agile thinkers. Let's get on the federal grid. And they went on the federal grid, so El Paso was the only city that didn't go through this. This was not minor. An 11-year-old child froze in his bed the second night with his brother next to him. 86 people have died. They think for sure 70 deaths are linked to the freeze. And the thing that gets me the most is, who can you trust anymore about what they say? So the first thing that Abbott said when he came on was that all this was caused by the use of green energy. So news stations started putting his statement with a big red cross going wrong, even Fox News, every single news station. Turns out that only 7% of energy in Texas, is from green energy, windmills mostly, of which my boyfriend in college invented the first windmill turbine and even designed the turbines of a water system over here and had the first windmill farm in Wisconsin. That's a whole nother story. But the issue is that there was not winterizing equipment on the windmills so that they could warm themselves up and stay generating energy, just as all the other energy sources had the same issue. And I'm laughing about it now. But when I fly to Naples this week, I'm going to stay for an extra 2 days. I've rented some kayaks and a boat, and I'm just going to hang out in the water and the sun if I can. In this show, we are going to talk about a lot of interesting things other than the cold freeze in Texas. We're going to talk about how much alcohol is okay and not okay because people are really drinking too much in the pandemic and now in the freeze. We're going to talk about the good news of asthmatics and COVID. We're going to talk a bit about urinary tract infections because most women are given the wrong kind of antibiotics and for too long, and there are some natural interventions to try right off the boat. And we're going to talk about plastics and toys. It turns out that plastics and toys, you got to hear this if you got kids or grandkids. And then we're going to talk about neurotrophins and what are these brain substances and how do they link to anti-depressants and to orgasms. So what the heck? And of course, if you are a member of Smart Plus Heart, my tribe, even though I had COVID, we still did a deep dive into soy. We had a phenomenal, almost 2-hour meeting to soy or not to soy and the science behind soy. So if you were a $15 a month member, go to drlindseyberkson.com/membership. You can always go back and listen to the archives. And then in the pro level, we did a 2-hour deep dive, an extraordinary dive of things you don't really know about vitamin D and what makes it so unusual that it's really the only substance that's an amine or a vitamin, meaning it's vital for life, and also a steroid hormone. It can swim in out all the membranes and then make changes in the genes and cells. So we did a real deep dive with clinical guidelines. And then we're going to now do another short dive in COVID and vitamin D and the science and what's happening with it, observational trials to the attempt to have randomized placebo-controlled trials. So we've got a lot to cover in the show, but because I had to dig so deep, and health is body, mind, and spirit. And when you go through stress, it's all about resilience and how you come out the other side. Okay, you could be better, but the main thing is you don't want to be ruined. God, please don't let me be ruined. So I was searching around for great things to read and be inspirational and bumped into some words from this younger spiritual type of persona in the United Kingdom. But boy, I want to go learn out more about Jeff Foster. So this is what Jeff Foster had to say that I thought was helpful for me during the last few weeks, COVID, and then on the coattails of COVID, freezing my patooties off and still needing to function in the world, and how to not become less than because of it, because sometimes that's hard to do. The name of what Jeff wrote is called The Exquisite Risk of Being Human. Sometimes, despite our best efforts to pray, align, dream, meditate, and attempt to manifest something different, life just does not go according to plan. The dream is crushed. The fantasy is ruined. A diagnosis comes out of the blue. A promise made is unkept. A plan falls through. Words are spoken or unspoken. Something you believed in was true was never true. Something is lost or found or never existed at all. And the ego, your ego, is humiliated. The seeker threatened. The self, yourself, ridiculed. That's how I felt, being so tight and stressed from the cold. The path is suddenly unclear. Certainty crumbles. And the tendency then is to run away from the sorrow. Avoid it. Pretend it's not there. Make out like everything is okay. But the pain of disappointment is not a mistake. Oh, I love that. The pain of disappointment is not a mistake. It's not a block, and it will open you up if you let it. It will keep you soft, flexible, and most of all, humble. And the truth is, you don't know, you never knew, you were never really in control, and sinking into that not knowing rather than fighting it can be the greatest liberation. This is the part that really got me. Humiliation is only a breath away from humility. You see it, and endings are nothing less than disguised beginnings. And it goes on from there, but I love that. Humiliation, which I felt humiliated with nothing working in a sense. I don't really go to anger because I always want to be able to heal the scenario, and I couldn't heal it. Humiliation is only a breath away from humility. You see, and endings are nothing less than disguised beginnings. So please, from your lips to God's ears. So one of the reasons I wanted to just do just a few sentences about how much alcohol is safe, because in the pandemic, garbage collectors are saying they're seeing so many more alcohol bottles inside garbage bins. It's quite extraordinary. There is an increase in drinking. I'll have a sip of water. And most people don't realize that most of the data now that's really taking a more strict methodologic look is saying that almost no alcohol is safe. Maybe a tiny, tiny bit, but can you keep yourself to that tiny, tiny bit? Maybe a tiny bit is anti-inflammatory, and aging and disease is mostly prolonged excessive inflammation. But the minute you get over a safe amount, and that changes, especially over 40 years old, they're not too sure what a safe amount is. So a new study came out a while ago called No Safe Level of Alcohol Consumption, Implications for Global Health. And I love it when a journal article has a title and you go, I don't even think I need to read that journal. I get the message. So people are starting to think there's almost no safe level because it is a poison, and most people can't consume. A woman really like 1 or 2 drinks a week, and a gent, they used to think it was 2 a day, but really you're over 40, maybe it's for gents, just a few a week, and most people just can't do that. Now, we do know that there are some studies that show that very small amounts, like 1 or 2 drinks a week, might be brain protective, but there's an article that came out here, Moderate Alcohol Consumption as a Risk Factor for Adverse Brain and Cognitive Outcomes. And they were able to show for those consuming over 30 drinks a week, shrunk the area of the brain where memories live. And even if you just drank a few drinks a week, over 3-4 drinks a week, there starts to be some adverse effect on the area of the brain where memories live called the hippocampus. So it's called hippocampal shrinkage or atrophy. Of course, higher amounts of alcohol had other adverse effects on brain architecture, structure, and brain shape has a lot to do with its plasticity. But there was no protective effect of light drinking, 1 to 7 units over abstinence. So people are taking a deeper dive into saying a little bit of alcohol is okay. But then there's the French paradox, but they drink wine, and wine might not be exactly the same thing as alcohol. And that's why Dry Farms wine is the best. It's the lowest amount of sugar in any wines and the cleanest. And you can find out more about that on my website at drlindsayberkson.com, and products we love, because we love if you can get the best type of wine if you are going to drink it. There is some stirring that maybe 1 to 2 glasses of wine, 1 per night for women and 2 per night for men, might be heart healthy. But then the other studies say we're not sure it really is heart healthy. And if you're over 40, might be the real deal. So that article came out in PLOS ONE, and they find where should the safe limits of alcohol consumption stand in light of liver enzymes abnormalities? So if you have elevated liver enzymes, you really shouldn't be somebody who's drinking. But what this also did was it took a look at drinking patterns and liver health. And over 40, there was an increased incidence in alcohol consumption and fatty liver and liver disease. So you have an older liver at 40, especially if you haven't been doing detoxes and exercising and living a really clean life and eating the majority of your food without a lot of chemicals for your liver to process. So different ages, people can have more liver aging, but if you have liver aging, you can't handle alcohol. So ask your doc what your liver enzymes are. I don't really like to see liver enzymes, even though they're normal up into the 30s. I don't like to see them in the 20s. Really healthy livers have liver enzymes in the teens. And you can take someone with fatty liver disease and improve them and normalize those liver enzymes, even though they're older, 50, 60 years old. I've seen that. So that's pretty cool. So there's some good news for asthmatics, because I know a lot of my friends who have children that are asthmatics or asthmatic themselves or a spouse that's asthmatic. They've been really terrified about COVID because we think of it as a respiratory disease. And it is a respiratory disease, but the severity of it becomes a blood vessel disease, a vasculotropic disease, but nonetheless, its entry is through the nose and the lungs, and then the lungs get clots. So it's a lung and a blood vessel disease, but because asthmatics are a lung disease, they've been worrying, are they more at risk? And should they have much more mitigating behaviors? So an article came out in Asthma and Risk of Infection, Hospitalizations, ICU Mortality. It came out in Journal of Asthma. And it just came out about a week ago. And it's asthma and risk of infection and mortality from COVID. And the good news is, and they took a look at almost 400,000 people, asthmatics appear to have less risk of getting COVID. And they appear to have less severity of disease if they get it and less fatality risk. And they are thinking possibly that in March, the COVID frontline physicians discovered that prednisone or anti-inflammatories were really helpful in hospitalized COVID patients because it cut down the inflammation in the lungs. And then that information became standard of care about July and August this last summer of 2020. But a lot of asthmatic patients are already on those types of drugs, so they already have like a layer of protection. Now, they didn't divide this up. They took a look at 57 studies that show that people with asthma have a 14% lower risk and are less likely to be hospitalized, but they didn't separate out the medications that the asthmatics were on that I can tell. So there might be some other protective effects, which is counterintuitive, but you got to follow the science and see where it goes. And with something so new as the pandemic and this COVID-19 virus, we're going to be having papers and books and things come out for a long time, and we're just going to be learning more things. So one of the things that I thought was really pretty interesting is a study that took a look at how antidepressants really work. And they work through growth factors in the brain called neurotrophins. We used to think that selective serotonin reuptake inhibitor works because it really helps increase the levels of serotonin and noradrenaline in the synapses, which make you feel better with your world. So we thought that was what that did. And we took a look at other types of antidepressants, and we have all this litany of reasons of why they work. But this new study that was published last week again in Cell says, no, that's not exactly, even though there's more serotonin that's in the brain based on serotonin reuptake inhibiting antidepressants, the antidepressant actually binds to something called a neurotrophin. It's really called brain-derived neurotropic factor, but we'll just call it for a neurotrophin. And they even found the little the parking space it binds into, which is called capital TR, small k, capital B, TRKB. It parks into TRKB. So antidepressants, when you're taking them, if you can't get off of them, you want something that parks into TRKB. You want a neurotrophic behavior in your brain, because that's really the way the antidepressant is helping you. And if you're having a hard time getting off, it might be that your brain needs to do that. And, we used to think other antidepressants kind of calm down this irritating neurotransmitter called glutamate. Even those now are thinking, that really, it's if you can get neurotrophic behavior in your brain is a happier brain. So what else binds to brain-derived neurotropic factor, right? Other than taking an antidepressant. And I remember giving lots of lectures on oxytocin, and oxytocin, certainly it's made in the uterus, and it influences the mother's brain to feel good about the baby when she first holds it in its arms. So the placenta, the uterus, it has some brain-derived neurotrophic activity, and it also stimulates that activity in the brain. So the very act of being a good mom is because you've got this neurotrophic activity in your brain. And they found that if they raise animals, or they measure some women and they don't have very good maternal skills, they have less of this, because you don't feel as good inside your skin. And it's hard to have something with someone else, it turns out, even your infant, if you don't really have it with yourself. So what else besides birth that you can do to boost these neurotrophic factors? Well, exercise, right? What is there that exercise doesn't improve, right? So, here's another article where if you just read the title, you have a bit of confidence, but it's still good to go in and read the abstract and the methodology and the discussion and so forth. But exercise induces hippocampal BDNF. So the hippocampus is where your memories live. I call it is your physiologic soul, because it's where your memories live. It's where your sense of self lives. And it's where your motivation, your mojo comes from. So I call it the home of the three M&Ms: meanness, memories, and motivation. And it turns out that you've got receptors for this TRKB and neurotrophics to bind in the hippocampus. So exercise turns on hippocampal BDNF and it binds there. So of course that's going to do it. Now there's red ginseng turns on that same brain-derived neurotrophic factor. Progesterone, there's a whole article, progesterone, brain-derived neurotrophic factor, and neuroprotection. It's one of the reasons that the old thought was if you don't have a uterus, but you go on hormone replacement, you don't need progesterone, but you have a brain and you have a hippocampus. So you do need progesterone because you want that brain-derived neurotrophic, that neurotrophic calming. When I say stimulation, it sounds oxymoronic because I really mean a calming stimulation. But estradiol, so hormone replacement, boosts brain-derived neurotrophic factor. And interestingly enough, diabetics have less of it. So high blood sugar tamps it down. And so diabetics need more ways to get this in. Maybe that's one of the many reasons exercise is beneficial for diabetics. But if women are on hormone replacement therapy, then they have less risk of getting diabetes. Their insulin receptors work better. And maybe it's also because they have more neurotrophic activity in the known places. We know now it signals. We'll probably find out more places where it signals. But what was really interesting is the brain, when they were talking about the neurotropic, brain-derived neurotrophic factor also living in the uterus, it made me realize that there is a uterine brain crosstalk. And I think it's somewhat because of neurotrophins. So after a woman gets a hysterectomy, she has a tendency not only to gain weight and feel less herself over a few years, it usually takes. Even if she kept her ovaries in, they never quite function exactly the same, and that's well substantiated with the literature. But if she goes on hormone replacement, she'll still get these neurotrophic actions and she'll not feel so bad. And most doctors don't talk to you about this, especially if you're getting your hysterectomy toward an older age in life. They figure, hey, that's when you were going to go to menopause anyway, or close to the time. But that is not the way to think about it, because you'd be missing out on these really cool factors that fluff and plump up your brain functioning via neurotrophins, brain-derived neurotrophic factor. And now we even know the docking name of the parking spot, but it turns out that estrogen, progesterone, oxytocin, exercise, lovemaking, and I'm sure there's a variety, and we even found that ginseng was an anti-inflammatory fact. This was Korean red ginseng, because there are different types of ginseng, tamped down nasty inflammation and boosted brain-derived neurotrophic factor protection. So that's really pretty amazing. We know the other thing too is that if kids are not well tended to by their parents or put in foster homes, or they have a really rough time in their family of origin years, then it turns out that they will have potentially damage to the genes that allow neurotrophic factors to protect the brain. And even the oxytocin receptor that has a lot to do with feeling good with your world. So those family of origin years, the first few years of life, are so important. And we've heard from psychologists and psychiatrists that much of our personality is formed, or at least the clay that we have to deal with, the first 4 years. Now we're seeing that it affects the expression of these neurotrophic factors and ways that hormones can benefit the brain. All those genes, the genes will function better if there was better love early on. And if there was more angst, more than the child could handle, there are issues with the ability to make brain-derived neurotrophic factor or get the benefit of hormone signaling, or maybe even the benefit of hormones. Maybe you're a woman in your 60s or so and you've tried hormone replacement and hasn't worked for you. Now, there's many possible reasons why. But maybe the genes to the cells that receive the signals from your hormones were damaged from unprocessed family of origin angst. We can process the stuff, we can do the work, but it's not that easy, and it's often layers of an onion. I wanted to make a mention of urinary tract infections because an article came out saying when insurance data was looking over how docs all around the United States treat urinary tract infections, and this came out in the last 2 weeks, women with uncomplicated urinary tract infections, so the kidneys aren't involved, they said almost half the time women get the wrong antibiotics, and 75% of the time they get them for too long. And a lot of that had to do with them getting the scripts for women that live in the country because they don't have as easy access to go back to their docs. But accumulating evidence was saying that isn't good, especially now we know antibiotics are not good for your gut microbiome, and that influences everything. And often women are given what's called broad spectrum antibiotics when the narrow spectrum ones work just as better for shorter period of time and have less microbiome damaging. But what about natural answers? Doctors don't know about this, and there are studies. There are peer-reviewed studies and non-peer-reviewed studies on a natural sugar called D-mannose. And you can use this to treat and to prevent chronic repetitive urinary tract infections. If you're part of my live group, we're going to have a deep dive on this at one point now. And in the pro group, we go into women who don't respond to this and why, because there's always a million reasons why anything goes wrong. Some women, as they age, get some obstruction in their urethra, and they have to go get mechanically stretched to stop having recurrent urinary tract infections. And most women know that they should urinate after they make love, but not all women know that. And some women are a little bit reactive or allergic to something in the sperm of their lover or the saliva of their partner. And there are ways to desensitize that, but there's so many potential reasons. But D-mannose is one of the first things many, many women respond to it. You can take it for treatment and you can take it for prevention, and you can look it up. You can go into pubmed.gov and put in D-mannose and see some studies on it. But take a look at the antibiotic prescription you get. You don't want a broad spectrum if you're going to go to prescription, and you want it for a shorter period of time, but maybe you want to first try D-mannose, and you can get it online or at a health food store, I'm sure, near you. I really wanted to make a mention on this because it's looking like we're going to have to go back to wood toys. Plastic toys are being linked to problems in our children's health, especially cancers. So out of the 419 chemicals found in hard, soft, foam, plastic materials used in children's toys, in this new study that came out, researchers identified 126 substances that can potentially harm children's health, either through cancer or non-cancer issues. And for example, like anxiety or lung issues or asthma. And soft plastics cause higher exposure to certain harmful chemicals, and inhalation of plastic exposure dominated because you keep the plastics in a carton in the kid's bedroom and they're continually outgassing for years. So you either need some air filters in your kid's bathroom, or we've got to look, because alternatives often are just as bad, if not worse, than the plastics. So a good piece of advice the researchers say is reduce consumption of plastic materials in general, but that means, well, what, are you going to buy wood toys? What are you going to buy? Everything's in plastic. There are scientists now who are saying that by the year 2050, there's going to be more plastics in the ocean than fish. But what to do, what to buy? This is the question. I really don't know myself, but I would love to hear from you. If you know, you can reach me at info@drlindseyberkson.com. But we need to figure out what to do, because these are contributing to the increased incidence of childhood cancer. There's a study that I just have to say this because I love to eat sushi. White rice isn't going to kill you. Oh, vindication after damnation of the cold spell. So this is good. This was a new study published in the British Medical Journal. Once again, these are all from about last month. They want to find which grains that you consume are really bad for you. They're linked to earlier death or an increased incidence of various diseases like heart disease. So the bad grains were croissant, highly processed white flour. And apparently the United States has the most highly processed wheat of any country in the world. I was just talking to somebody who lived in Norway for a while, and they were saying that all the bread products they got were kind of rough. You could tell that they were coarse because the flour was coarser. It wasn't as processed. And somehow in the 50s, we got into thinking that flour should look a lot like sugar, and that meant that we had more money and higher status, but that's ended up to be a status goal that has come back to bite everybody. They took a look at over 16 years of analysis of almost 140,000 people in 21 countries, looking at what refined grains did to people's health. And they found that the United States had the most refined grains and the highest consumption of them, bar none. No other country in the entire world. Look at what's going on with us in COVID, and a lot of that is due to the metabolic syndrome. Not all of it. But grains were classified as refined or whole or white rice. And by the way, don't forget that whole grains can also mean buckwheat. People forget that there's buckwheat. And they found that having multiple servings, it was 7 servings, which it's very easy to get. You have a piece of bread, you have a pancake at breakfast, you have a donut, you have a sandwich at lunch, you have pasta at dinner. You've already, you have a cookie here and there. It's very easy to get to 7, even though that sounds like a lot. They found that if you have 7 servings of refined grains, that's that white, highly processed. So that's whitish bread, that's croissants, that's cookies, was associated with almost a 30% increased risk for dying earlier. And almost a 35% increased risk of getting heart disease, and almost a 50% increased risk of getting stroke. Almost a 50% increased risk of getting stroke. What was really crazy is no adverse effects were seen with whole grains, at least in the way they were looking at things in this study. And there wasn't any adverse effects seen with white rice. Wow. This study showed that white rice was healthier than processed flour, like wheat flour. And it suggests that eating whole grains like brown rice, barley, quinoa, I love brown jasmine rice, basmati rice. Brown jasmine basmati rice is my favorite, and I love black rice. That would all be part of a healthy anti-aging program. So, a lot of gluten-free breads are very high glycemic index and very processed. Most gluten-free breads are really processed. So I searched for a gluten-free bread that was less processed and really delicious. And the one I found was Sprouted for Life Original 3-Seed Bread. And they sell it in the freezer section because it's very fragile, because it's made with a lot of grains, and fresh whole grains have a lot of oils in them. That's why they process grains in the first place, to have longer shelf life. So if you ask your store, they often will get something for you if they don't have it. And I love that toasted. It's really great toasted. It's much better toasted than not toasted because it's so thick with fiber and the outer shells of many of the grains in it. So just so you know that, let's see. And that's important to know. And there's also Mary's Gone crackers. She's been around for a long time, and she has crackers made out of all kinds of seeds. So you can find some really great breads. Karen just gave me the link for an amazing quinoa bread that you can order online. And I know a few quinoa pastas, so I'll put those in the show notes at drlindsayberkson.com on the podcast area. I'll put that in the show notes, and you'll be able to decide what you want to give a try to and what you don't. So I love the title of what Jeff Foster wrote. Let me come down here and get it again. It's just so beautiful. And it's why can't I find it now? The exquisite risk of being human. It is risky to be human, and it's risky to go out of your comfort zone. But if you don't risk, you end up being on the other side of it, none the better, and never knowing what would have happened if you did risk. But it doesn't mean that you should risk irrationally. What's interesting is a study came out a few months ago that people who tend to take acetaminophen on a daily basis have more risky behavior, but not the good risky behavior. A little bit of the maybe gamble or drive too fast, the not so good risky behavior. It's so interesting. And an article came out the other day about how some people with certain genes have an easier time for gratitude, and other people have a less easy time because of their genes. So being human is so multifactorial. And we so want somebody to tell us, in a 3-day weekend course or a 6-week online course, the 5 top reasons you can get your brain in line and your money in your bank and you can have everything together. It's such an American way to look at doing something really rapid and having it all organized and looking up to an expert and giving them a plop of money, hoping you're going to come out the other end all organized yourself. But being who you are is a lifelong process. And there's times the disaster happens in Texas, and there's times the diagnosis happens. But I do know this, that the more you exercise and eat well and take an intentional dive within yourself to know your roots of origin and your glitches and I call them your theme parks, what consistently shows up, because there's a lesson in there for you to kind of embrace so you could finally make it stop happening. It is an exquisite, risky deal being human. And I appreciate you letting me be part of your journey on it with this show and with my guests. So, dear friends, hope your experience of being human is a little gentler on you from what we've been going through the last period of time, because there's still a lot of people being diagnosed and dying of COVID. And the planet is going through stress, so I send you some good energy.